Here in Washington state, health leaders are warning that another big wave of COVID could arrive later this year.
Looking at the latest numbers from the State Department of Health, the current 7-day case rate has jumped again up to 185 new cases per 100,000 people. The number of hospital beds being used has gone up as well, 5% of them in use right now across the state. On the vaccination front, more than 72% of eligible Washingtonians have gotten the first series of the vaccine. And with those case counts on the rise, local doctors are sounding the alarm.
Fox 13 News reporter Alejandra Guzman joins us now in studio. Alejandra, what are health experts seeing when it comes to COVID right now?
Well, Jamie, David, I can tell you that doctors say the surge we're seeing right now is due in part to two things. One, a highly infectious variant, and say a second one is already on the way. And the fact that so many of us have let our guard down as mask mandate has already ended.
I've been very cautious about COVID and doing all the necessary things, including all 4 shots.
You can hear the hoarseness in Merle Carter's voice.
When I woke up this morning, I noticed that I had kind of cold-like symptoms.
Sore throat, body aches, and a runny nose he thought were normal, but out of caution, he took a home rapid test.
Turned out positives.
He waited 20 minutes and took a second one.
And sure enough, it was positive.
Shocking results after the 78-year-old says he felt fine yesterday. He is now one of the many Washingtonians to be positive with COVID, despite being vaccinated and boosted twice.
Just sort of snuck up on me.
We're steadily approaching 1 million deaths due to COVID in the U.S., a tragic number. Dr. Lynch with the University of Washington says the aftermath of the virus is far greater.
Far more people died due to COVID-19 than 1 million people. Just that's 1 million people we can attribute it to. Very clearly.
It also doesn't capture the number of people still suffering with the after effects, long COVID, and other serious outcomes due to the infection. Locally and regionally, he is concerned with the increase we're now seeing.
Unfortunately, this is translated into increasing hospitalizations. Just recently, the death rate has started to increase just a little bit as well, which hadn't for, probably a couple of months.
Indicators, he says, are going in the wrong direction with no peak in sight. Our positivity rate is at 20%, very high historically, according to Patrick Mathias with the Department of Laboratory Medicine and Pathology at UW-Medicine. But the number could be far greater and going unreported due to at-home testing.
It's harder for us to predict multiple weeks from now what kind of resource limitations we might have on the hospital side in terms of ICU beds or hospital beds. If we don't kind of see those cases earlier.
Even more alarming, fall and winter, as 100 million COVID infections are predicted.
We have to prepare for that because we could have new variants.
Another red flag is the hospital system, which is already stressed, and while critical care for COVID patients is not being seen, doctors do warn that these new numbers impact clinic visits and access to treatment. Back to you guys.